So I want to give you the welcome. So thank you so much for your patience. We understand there was an accident in the freeway, so thank you for making it safe. My name is Ileana Madrigal. I proudly work with North Bay Labor Council FLCIO. And it's my pleasure giving you the welcome for our second forum of this year and many to come. So thank you for showing up. Thank you for supporting the labor movement. And thank you for our panelists to show up in collaboration with Sonoma County Indivisible. So I want to introduce Kim to give another welcome.
Yeah, you're getting my name's Kim Keller. You're getting two welcomes because Indivisible North Bay Labor Council are co-sponsoring this together because it's so important that all the organizations that are fighting to make things better and to stop what's going on and even get things even better have to work together. So it's been great to partner with you guys. So that's about it. We're going to move the program right on. We've got, thanks to all the speakers, thanks to all of you for coming. We've got a great set of panelists, and I think you'll learn a lot. And mostly we want, if you're not active yet, we've got lots of ideas for how you can get active and how you can get more active. So thank you.
And I would like to introduce our political director from North Bay Labor Council, Maddie Hirschel.
Hi, everybody. See, you can't get away without hearing from me. So thank you again for being here. As Ileana mentioned, this is our second forum. We did a forum about 6 weeks ago on veterans issues. That was very well attended and very well received. We started doing these rallies, and we thought, what other way could we be helpful and participate? And so we started doing these forums. And the North Bay Labor Council is proud to do this. We are one of 70 different labor councils in the state that are an arm of the AFL-CIO and the California State Labor Fed as a way to reach out to folks. We work to protect the rights of working people, all people. It doesn't matter if you're a member of a union. That saying that, a rising tide floats all boats, that's what we work on. So thank you again for being here, and I hope you enjoy the forum.
Thank you, Maddie. And last but not least, Jack Buckhorn, our executive director, is going to give the description on what you have in your hands.
Great, again, welcome, and thanks for being here. So we've got a panel of 5 experts. We're going to be covering the economy, the economics of the Budget Reconciliation Act. We're going to go down and then talk about healthcare, how it's going to affect our healthcare, immigration, what it's going to mean for the immigrants that are working in our country, the food insecurity that we're going to be experiencing because of the cuts to SNAP, and the environment. So there are 5 very important areas that we're going to be covering. We're also going to have time for questions. And if you have a question, please, hope you grabbed one of these forms. If you didn't, let me know. We'll be able to pass them out. Write it down, we'll collect them, and then we'll go through it, and we'll, if we have duplicate questions, we'll add them together, so we can get an answer. But we want this to be two-way. This isn't just a lecture that's going out. This is a communication. This is our ability to talk about these very important issues that our country is facing right now. So we need to hear from you. We want to hear from our content experts, and this is the way that you can get your questions answered. So hope you picked one up. If you didn't, raise your hand. I'll get it to you. And we're going to get this show started right now. So, Eliana, are you going to kick it off, or you want me to hand it off to Enrique?
Enrique.
So, Enrique I'll let him introduce himself, but he's going to cover the big, broad economics of this bill. Get us started. So, Enrique, it's up to you, brother.
Thanks so much. Can you hear me?
Yeah.
All right. Good evening. Thank you for having me. My name is Enrique Lopezlira. I'm the director of the Low Wage Work Program at the UC Berkeley Labor Center. I'm an economist by training. And just to give you an idea of low wage, the way we define low wage is anyone who gets paid less than 2/3 of the area median income. And so, it changes over time. We have, if you go to the Labor Center's website, we have a tool called the Low Wage Data Explorer, where you can see the characteristics of low-wage workers in California. You can look for a lot of the characteristics by region of the state, and so you're interested in your region, you can see what the share of workers who are low wage and what industries they're in and occupations they perform and so forth. I was asked today to sort of give an overview on the economic policy piece, and then the rest of the panelists are going to get more granular on the respective areas. I'm going to keep it brief. I only have about 4 slides because I'm really interested in your questions and answering any questions you have that we may be able to answer. So the first slide I want to show you, the numbers are kind of small to read if you're further in the back, but if you just look at your left of the slide, what it shows is how much resources for households who are in the lowest rungs of the income distribution are going to get from HR1 or OBBA, however you want to call the legislation that was passed. And as you can see, the vertical bars are in the negative. So the lowest income households are going to get decreases in the amount of resources that they're going to have when the bill is implemented completely. Now, let me just pause for a minute and talk about what I mean by resources. Is the bill is a combination of things. It's tax cuts, it's cuts to programs, federal programs. It changes some requirements to qualify for some programs. It also changes other programs like student loans and so forth. So this is sort of the net. If you net out all the all the gains from tax cuts minus the losses from federal programs that these households qualified for, etc., that's what we mean by the change in resources. And if you look towards the right, the highest income households, the bars are all positive. And the highest of all the income households, it gets the biggest increase in resources through this legislation. So this is one of the largest transfers of wealth from low income households to high income households we've ever seen. If you go to the next slide, this is called the Tax Cuts Forum, and like I said, there's many things in the bill, not just tax cuts, but if we just focus on tax cuts, you can see that the poorest of the income groups do not get any tax cuts out of this bill. The richest of the income groups get almost 3/4 of all the tax cuts in this bill. So the tax cuts here are benefiting primarily the top range of the income distribution as well. If you go to the next slide, you can see how this bill is structured, right? And it's going to add $3 trillion to the national debt, and it gives $4.5 trillion in tax cuts. Now, as an economist, the national debt by itself, it's a hard topic to understand. If you're increasing the national debt, but you're using it to improve the economy through investments in its workers and its people and its businesses, that's one thing. But if it's just giving cuts to wealthy individuals, then there's a real question about whether it's worth increasing the national debt by $3 trillion. How they're going to pay for these cuts is on the bottom, the savings bars that you see there. And what you see is that the biggest way they're paying for this is cutting Medicaid. So this is the largest cut to Medicaid in its 60-year history. Medicaid, green, energy, environmental programs are being cut. Student loan programs are being cut. Food benefits for the poorest individuals are being cut. There's other cuts to healthcare, and then it's also changes to natural resources. And those are being used to fund the $4.5 trillion in tax cuts from the bill. How am I on time? Where's the timekeeper? I'm good? Okay. 7 minutes. Yeah. So the next slide, the next 2 slides, I just want to talk a little bit about Medicaid, because like I said, Medicaid is the biggest program being cut in this bill, and is the biggest cut to the program in 6 decades. And the effect of this is that millions are at high risk of losing healthcare coverage. The last number I saw was about 12 million people will lose coverage expected under the bill. And Medicaid primarily impacts the most vulnerable. So we're talking about the folks on Medicaid are people who are older, have disabilities, or they're the lowest wage workers. So one of the misconceptions about Medicaid is that, in the bill itself, they increase some of the work requirements of these programs on Medicaid. But Medicaid already is covering workers. So one of the biggest misconceptions is that people on Medicaid are not working, but a large share of Medicaid recipients are actually working already. And so having additional work requirements to qualify for a program when you're already working is going to be very difficult for a lot of folks, which is why we see the potential loss in coverage. So in California, there's some regions have more enrollees in Medicaid than other regions. If you go to the Labor Center's website, and I imagine they'll make the slides available if you want them. There's links to some of the reports that our healthcare team has done, and they have a breakout of who's enrolled in the share of people enrolled in Medi-Cal, by county. And so if you look at, and you can look at by all ages, or you can look at just teens and children. So for example, in Sonoma County, I think it's like 48%. In Marin, it's like 35%. So you can see by county. They also have it broken down by congressional district. So there's different cuts to the data. So you can see more granular how this will affect your region. So losing healthcare coverage doesn't just affect the workers. There's economic impacts that go beyond that, right? So this next slide here is just talking about some of these other things. So we expect that because of the cuts to Medicaid and the loss of coverage, there's going to be a loss of jobs. So the latest estimate we have is about 217,000 jobs will be lost in California through these Medicaid cuts. In Sonoma, it's anywhere from 1,000 to 2,000 jobs are expected to be lost. If you look at Sonoma, Marin, and Napa, you're looking at 1,700 to 3,400 jobs that will be lost from the cuts. And then there's the ripple effects, right? So there's a thing that economists call multipliers. When you go to the store and you spend $1, the store owner gets $1, but now he has $1 to spend somewhere else, and so forth. So there's a ripple effect to these things. And so the economic impact goes just beyond the individuals affected. It goes to the suppliers of healthcare companies. It goes to the people who support these jobs just through being merchants around where they work and so forth. So there's ripple effects that go beyond that. And then there's the lost state and tax revenues. And if you follow California fiscal situation, it's already in some trouble, and so there's additional losses from this. So I've gone very fast, and it's an overview, but I'm happy to answer questions in more detailed questions if you have them. But the idea of this is that no matter what analysis you do, and by the way, a lot of these numbers come from the Congressional Budget Office, which is a nonpartisan entity whose job is to analyze the impact of legislation. You'll see that no matter how you look at this bill and how you slice it, is a wealth transfer from the poorest to the richest. And there's economic implications for all of us, not just for those poorer households who are getting targeted through this legislation. So I'll stop there and move to the next panelist. And again, happy to answer any questions you may have. Thank you.
So yeah, next up is VIDAS.
Okay, thanks, Jack. And thanks, Enrique. That was really helpful overview. I am not an economist. I'm a lawyer who represents individual immigrants, and so...
Come up to the mic.
Oh, okay, thanks. I'm a lawyer who represents individual immigrants, and so I'm going to be speaking in anecdotes for the most part and not in big picture data. But let me ask to start with, how many of you were on Farmers Lane on June 14th, the No King's Day action? Wonderful. Very good. That was June 14th. On June 18th, ICE came to Santa Rosa. And they came to Farmers Lane. And they picked up a janitorial worker when she went out of the office that she was cleaning to dump the garbage in the dumpster. And that's when they got her. This is a woman who's been in the United States for 20 years from El Salvador. When she crossed the border 20 years ago, she was caught and went to court and was given what's called a notice to appear that starts deportation proceedings. But then she came to California. She was brought to California by a man who knew her mother, and he brought her to live in his house, and he was abusive. He was abusive in terms of labor and abusive in terms of sex, and she never got the letter from the court that said that she had to go to court on a certain date. When you don't go to court, the judge enters a removal order, a deportation order. And so for approximately 19 years, she had a deportation order. They decided to enforce it on June 18th, 2025. We'll call her Ms. M for privacy sake. Ms. M was taken to San Francisco first, and a wonderful lawyer down there in San Francisco who works with the Rapid Response Network, Katie Kavanaugh, filed a motion to reopen that deportation order with the court that had set it. And then she called and tried to find legal help here in Sonoma County, and we volunteered at VIDAS, and so we supplemented that motion, and the judge granted our motion to reopen and removed her removal order. Okay, she no longer has a deportation order. That doesn't give her legal status in the United States, and so she's still at Mesa Verde Immigration Processing Center in Bakersfield a month later. Now, one reason I wanted to tell you the story of Ms. M is that she has diabetes, and they're not giving her medicine as they should be. Back home, she would be getting shots of insulin, thank you, twice a day, and taking an oral medication as well. But she tells me that she gets the oral medication from time to time, and maybe gets the shot of insulin every other day. And consequently, she's been to the hospital 3 times in the month since she got to the Bakersfield detention facility. And she told me that on one of those occasions, her blood sugar measured at 700. Those of you who know about blood sugars know that that's outrageous. Typically, a fasting blood sugar is under 130. Even after a meal, it should be 200 or less. This is 700. So this is a woman who's doing badly, and when I speak to her, I can hear that she's not able to really tell me her story very well. Why do I bring this up in the context of this OBBA, this HR 1? Because what that bill is going to do is ramp up what happened to Miss M in a horrifying amount. It's $170 billion for immigration and border enforcement. $170 billion. Of that, $29.9 billion goes towards ICE's enforcement and deportation operations, so hiring more ICE officers, and it's estimated to increase ICE's annual budget 3-fold. Okay, so we're going to be looking at 3 to even 4 times the kinds of activities that we saw on the TV, on YouTube, in Los Angeles, around the country. as we just heard from Enrique, this is funding ICE while we're not funding Medicaid and healthcare. They're, interestingly, capping the number of immigration judges to hear people's cases at 800. So they're not really interested in having people go through the due process that's been set up. What they're interested in is building camps, building facilities. Now, we are the victims of our own success here in Northern California, and the interfaith movement for human integrity, amongst other groups, churches, managed to get closed the immigrant detention center in Richmond and the one up in Yuba County. And so we don't have immigrant detention in Northern California, and so if you represent somebody, you have to go down to Bakersfield or Adelanto outside of LA. But they're talking about possibly reopening that Dublin federal prison facility as an immigrant processing center. And of course, Donald Trump talks about Alcatraz. There's $46.6 billion for border wall construction. As the American Immigration Council says here, that's more than 3 times what was spent on the first Trump term, despite the failure of the wall to improve or contribute in any meaningful way to border management strategy. And then there's this $10 billion fund to reimburse the Department of Homeland Security for costs related to, quote, safeguarding the borders of the United States to protect against the illegal entry of persons or contraband. That's what they say. That's their narrative, right? But in fact, what we find is that they're pulling Customs and Border Protection agents off the border, where they would be screening for fentanyl and other contraband coming into the country, in order to help ICE in the interior of the country pick up workers. And I say workers because the analysis is that 69% of the people being arrested are not felons. They're not even misdemeanors, right? Some 7% are convicted of violent, serious felonies. So the gap there, what is that, 76%, so 24% are just misdemeanors. I see I'm running out of time. Let me just tell you that we've got a table in the back there. It says VIDAS Legal, and there are some action steps. There's a little flyer that tells you about VIDAS, but then tomorrow there's a webinar being put on by National Day Laborers Organizing Network, NDLON, on how you can help at Home Depots or other labor shape-up corners, help protect immigrants. I invite you to go to the table and see what we've got. Thanks.
So I'm Allison, can you hear me? Yes? From the Redwood Empire Food Bank, and I'm going to completely screw up this lovely woman who introduced herself and said, I'll do your slides, because now I'm just going to wing it, so who needs slides anyway? Because really the idea of why you're here is to learn something, and I hope to teach you something on behalf of SNAP cuts and food security in our region. But I'm feeling like we also need some uplifting, what are we going to do about it moments. There is an economic impact to SNAP cuts. So in California, we call that CalFresh because California likes to be special and different, and so we rename things that are the same. So if you're hearing SNAP on the news, that's the same as CalFresh. It's the same as what people used to call food stamps. Essentially, those cuts are really substantial. The people that turn to the Redwood Empire Food Bank for help, some of them access SNAP benefits and are on CalFresh. Others don't qualify for a variety of reasons, and in this current moment are terrified to sign up for such benefits because all of their information, more so than it already is available to the federal government. So what we're seeing from a food security standpoint isn't data that we can say, oh, for sure, the reduction in SNAP access and the reduction of our food lines going up and down week after week. It's not because the need is decreasing in any way. It's that fear is so imminent for people that when ICE was in Santa Rosa in June, I mean, we were sending food back on our trucks, which is not a normal thing. So after distributions, we're calling drivers and saying, so can you come pick up pallets of food? Because people weren't coming for food distributions. Now, in July, we're running out of groceries that we're trying to plan for because people can't go without it. So the second they're feeling like, okay, ICE apparently isn't here days in a row, now we got to go out and get the groceries that we need. And so then our numbers are skyrocketing again. Really, we need to continue to be nimble because we don't know how long this roller coaster is going to last. And the Redwood Empire Food Bank prides ourselves on being super accessible and really kind and really welcoming and having a proxy system that somebody can pick up for somebody else as long as that participant has given them permission. That has nothing to do with immigration, but it certainly helps in a time like this. So it could be that somebody says, oh gosh, my neighbor has a car, they're willing to help, or I have a medical appointment, I'm gonna have my daughter-in-law go for me. They don't have to tell us that it's because they're concerned about immigration. They don't have to tell us the relationship of who that person is picking up for them. But we are looking for allies in the space. We're looking for volunteers that are still greeting people, with a smile and without judgment, because respectfully, we don't care what their status is. We're here to make sure that they have the food that they need to support their families. There is a large economic impact. So speaking about SNAP benefits, and it's not just to the people that would otherwise be using those benefits for groceries, but it's the grocery stores, it's the delivery drivers, it's the food manufacturers, it's those people stocking the shelves. So really SNAP benefits, even the Redwood Empire Food Bank, we say, wow, we can turn your dollar into $3 worth of food. Well, SNAP does that times 9. So even just relative to all that we could do in our community, we can only do that really coupled with SNAP benefits for people, because there's no way that we can make up the economic impact to the delivery drivers and the food manufacturers and so on down the line. So really, I just implore everybody to be bold and loud and join our advocacy efforts. Stand up for what's right and try to help people, because it's going to get certainly more and more ugly as these cuts come, because they're not really taking effect until 2027. So the fact that we've served more people ever in our history in March and April, of 65,000 individuals in each of those months, in our community where there's access to services and incredible wealth for some. So we live in a beautiful place, but it's expensive for people to live here. So that's just the people that are willing to swallow that pride and the inconvenience of waiting in line. That really, again, is not even an indication of what you all do. So there are smaller organizations that are saying, how can we help? Are there people that need us to pick up groceries for them? I emphatically say yes. However, I emphatically do not have their data to know who they are, to say, oh, well, they don't have legal status, help them. I don't know those things, but I implore you in your own communities and small groups to say, I'm happy to pick up groceries for somebody, who is it that I'm picking up for, and how do they provide me access to do so? So thank you, and happy to answer questions too after the fact.
Awesome. Good evening, everyone. My name is Eliot Enriquez, and I am the Director of Government and Community Relations for the Petaluma Health Center. I've been with the Health Center for about 11 years this month, actually, and I've been working in community health centers for 15. And I can safely say that during that tenure, our community health center network in Sonoma County and in the state of California has never been so vulnerable. And unfortunately, we're not just being attacked at the federal level, we're actually being attacked and pummeled at the state level as well. And I'll get into that in a little bit. So I did bring a few slides, and we're going to go to the second one. And I do really want to showcase this slide. I wasn't sure how much time I had, but now I really do, because I want everyone to see what we have to risk here. So the Petaluma Health Center is a nationally recognized health center. It's recognized to be one of the best community health centers in the state of California and also in the country. We offer over 20 on-site different services across 12 sites in southern Sonoma County and also in Marin County. So we actually have patients in Sonoma and in Marin. We're a very strong local employer. We provide over 500 jobs in Sonoma and in Marin counties. So, and these are minimum wage jobs. Our entry-level positions start at $22, I think $23 an hour now. And all of this is at risk now. We have built this organization for over 20, almost 30 years now, and we're about to take a huge step back in our community. We are the safety net, I like to say, for the low-income folks, because not only do we provide medical care and quality medical care for everyone in our community, but we also partner with almost every other local agency to make sure that these patients are getting all of the other safety net services that they qualify for. And that's just the Petaluma Health Center. If we can go to the next slide. So in Sonoma County, we're actually a very unique county in the entire state of California. There is no other county in the state of California that has 8 different federally qualified health centers, or 8 community clinics. As you can see, all the way from Alexander Valley, all the way down to West County Health Centers, there are 8 different community clinics. Amongst those 8, we have 37 sites all throughout Sonoma County that provide care to our most vulnerable communities. And not just our vulnerable communities, because we see everybody in the community. Next slide. Okay, so this is just a bit of a breakdown in terms of our patient data in Sonoma County. So as you can see, community health centers in Sonoma County, we serve approximately 126,000 patients. That is 1 out of every 4 people here in Sonoma County, right? Total Medi-Cal patients, just amongst community clinics, we have 77,000 patients. Medicare patients, because we see also a lot of Medicare patients within our region, 14,000. And then we have a total of 14,000 uninsured patients as well, okay? And now, for the bottom 3, that's who's really going to be targeted and is really being targeted by federal and state cuts that we're going to be feeling at the beginning of next year and also into 2027. Next slide. Okay, so for those of you who don't know, what do we mean by low income, okay? And these are the federal poverty guidelines, and I hate to use the word poverty because it's not really reflective of what's on this slide, but this is what we use for families to kind of teach them what programs they qualify for here in the state. And this is statewide, all right? This is a slide that I pulled from the Covered California website, but Sonoma County's in here as well, right? So in order to qualify for Medi-Cal, which we've been talking about, which is also Medicaid for those of you who don't know, for a family of 4 in Sonoma County, you cannot make more than $44,367. If you make $44,368, you do not qualify for that program. So imagine a family of 4 in Sonoma County making that amount of money, trying to get by, and then all of a sudden, go to the next slide, they're gonna get hit with work requirements, right? Now, for us in Sonoma County, that's not really a big deal, because the majority of our patients, the majority of people who actually have Medi-Cal or Medicaid are our working families. They're what we call the working poor, right? So many of them will not be hit. The requirements that are being put in place by the federal government of at least 80 hours a month of either working, volunteering, or other activities will not really affect them. But there is a 10%, right? There are probably 10% of all of our patients in Sonoma County that have Medi-Cal or Medicaid that will be affected by this, that will have to figure out a way to stay on this program. The second mechanism that this stupid big bill applies are biannual redeterminations, okay? So now, in order to have Medi-Cal, to stay on Medi-Cal, to keep your Medi-Cal benefits, you renew once a year, right? Your annual redetermination comes up. We have staff at the health center that help all of our families either complete their first application, and we help them stay on their health insurance. We actually do the renewals for them. Well, now these families will have to renew every 6 months, right? And the trick is, families are gonna forget. It's not something that they're used to doing. So basically what this is gonna do, a lot of families aren't gonna do this, it's gonna kick a lot of families off of their Medi-Cal. So what's gonna happen is, once you're kicked off of Medi-Cal, you're gonna have to go through the entire renewal process again. You're gonna have to start a brand new application, right? Do the entire renewal process that can take anywhere between 3 to 6 months in Sonoma County to get on Medi-Cal again. But that is the plan, okay? As a result, I don't really have any data right now just for Sonoma County, but in the state of California, these two mechanisms, if you will, are going to cost, or are going to take between 850,000 to 1.7 million Medi-Cal beneficiaries off of their benefits. That is an equivalent of 5.4 to 11.1 billion dollars in lost revenue for the state of California, and especially for community health centers. So, as most of you know, we're past COVID. We showed up for this community when this community needed us, right? We did it, you know, if you couldn't get into Kaiser, if you couldn't get into Sutter, you were coming to the health centers and we were taking care of everybody. And now we're being asked, right, to pretty much sacrifice a lot of the network and a lot of the systems, the healthcare systems that we built in Sonoma County, and just because these federal agencies are applying this to us. And there's more. Unfortunately for us, we're not only being attacked at the state level, at the federal level, but we're also being attacked by the state agency as well. So we're going to lose a lot of support. My ask for you, for everyone here today, is to please reach out to your local representatives and ask to stand up for your local community clinics. Thank you.
Hello. Can everyone hear me all right? Louder? My name is Una Glass. I'm the Executive Director of Sonoma County Conservation Action. It's Una Glass. Sounds like a company, but it really is my born name. So I am here to talk about the effect of the big ugly bill on the environment. And the more I researched this over the past week, in order to make this presentation, the worse it looked. The big ugly bill is just doing so many bad things to the environment, but it's embedded in so many different parts of our government that it's hard to actually nail down all the places that are being affected. In the course of doing this, I actually called Congressman Huffman's office. I spoke with people in the Board of Supervisors, and I spoke with people who work at state agencies for the state of California. And what I found was that they actually do not have full measure of exactly all the impacts yet, because the environmental impacts are so dispersed and disparate that it's hard to nail down. It's like you're not just dealing with one particular agency or one particular thing. And it's kind of just embedded in everything in this big ugly bill. So when you think about this big ugly bill, what we're seeing now is the spotlight is on the horrible, horrible things that are happening on a daily basis to immigrants. We see people being taken away, deported to countries that are in other continents where they don't speak the language and they've never been there. just incredible, outrageous things are going on. So we're spotlighted on that, and obviously those issues are very imminent. There are issues that are affecting people right now, and if they don't get help right now, as you've heard from everybody here, people are going to be without food, they're going to be without health care. And those are very, very critical matters. However, the environmental damage of this bill is more of like the silent killer, the degradation, and it's actually the kinds of things that are done with this bill represents an existential threat to us as humans and our planet. because they've pretty much completely undone everything, all the progress that was being made towards mitigating climate change and solving the issues of our environment. So the thing about this bill is this is just the beginning. This is the Project 2025 people setting the table so that there will be more cuts. And this bill is just about taxation and mandated programs. Now, after this, we're going to be seeing more cuts and more information and more budget process and more deletion of various agencies and getting rid of more personnel on top of all the crazy things that have already come from DOGE. So what does this bill do? It's, to start out with, it's opening the floodgates to reckless drilling and mining across millions of acres of public land and along America's coast. So if you can think about offshore drilling, about opening up more oil and gas exploration, of releasing more toxins in the environment, this is the bill for you. This bill will also increase Americans' energy costs. They're putting up roadblocks to clean energy projects that have been, the rest of the world is all on board with moving towards clean energy, not us. We're going massively backwards. It supercharges reckless oil, gas, and coal development while gutting safeguards for clean air and water, putting families, especially in the front line, and particularly tribal communities, at greater risk of asthma, cancer, and toxic pollution. So this bill is setting us up for the silent killer. It's not the thing where people are going to starve immediately. It's not where people aren't going to get health care immediately, but the impacts in the long run mean that all of us are going to be exposed to more toxins and more climate disasters. This rescinds funding to protect communities from climate disasters. So it's defunding programs that help communities build resilience to floods, fires, and other climate-related disasters. So here in Sonoma County, that's pretty darn important to us. We've seen what happens with the results of climate change, the results of drought, and so on. And this bill takes away funding, and you can think about taking away that funding for helping our county do wildfire hardening, helping people make sure that their homes are safe from wildfires by helping them do the right measures to make their homes more safe and renters' homes more safe. Well, that money's going away, but on top of that, there are these plans to gut FEMA, which is the agency that rescues people after the results of these climate changes are manifesting in our communities. We can just see an issue or an example of this today where the Trump administration refused to give money to help Maryland, a blue state, recover from recent floods. They gave money to Texas, but they didn't go give money to Maryland. So that's pretty incredible. So what's actually happening in our area? Like, I tried to find out, because our county government doesn't even realize or hasn't analyzed yet all the impacts of this, but I found out about a couple of examples. So one of the things that got defunded was a grant that would help fishermen out in Bodega Bay get more efficient ice production equipment that will stop using illegal refrigerants and help them be more economically viable with more efficient equipment. We've lost another grant that was for fire hardening and helping homeowners, especially low-income homeowners, respond to the fire threat by removing debris, et cetera, around their homes. This is just two things that have happened in our community. I could go on, like I actually have this massive list. It's 69 impacts of this bill on the environment. And I could probably bore you to tears if I read all of it. But suffice it to say, these proposed cuts are going to massively cut back on the ability of national parks, the Bureau of Reclamation, the BLM, NOAA, the Forest Service, and so many other agencies to engage in the environmentally positive activities they have done in the past. And this work that is being, these jobs that are being taken away by this, as well as the new climate friendly energy projects that we had in place under Biden are all going away, which means this affects jobs, not just our environment and our health. And if you have any questions, I'll be in the back there next to the Conservation Action sign. And I can answer questions here today.
Thank you, Enrique. Thank you, everybody. I want to ask you to give a round of applause to all our panelists, and also, if you have a question card, please raise it to the air so we can collect them. And then Jack and Maddie are going to be reading the questions that we have collected so far. So if you need one, please let us know.
So we've got a pretty good collection of questions so far, and that's great because this is a conversation and we need to get it started right now. So I'm going to just go from the top down. This first one I think is for Enrique. And it says, what can the governor and California legislature do to address the massive transfer of wealth to the upper 1% and levels of inequity in California compared to the 1920s? More progressive taxes, these are questions. Raising the minimum wage, question. Protecting the right to organize a union. So any ideas on policy that we can implement in California to address this?
Yeah, that's a great question. So definitely improving the right of workers to organize and will help not just with this bill, but all the other issues that are facing workers in California. So this is a terrible bill for the low-wage workers and working families, but there's other state and local issues that are also affecting these workers, and so improving worker power through better ability to organize and enter into collective bargaining agreements definitely will help workers. So also, the minimum wage it helps workers out of poverty. Recently, we've seen in the state of California, as usual, sort of leads the way in many of these things. So we've had sectoral minimum wages in fast food and healthcare that are sort of the first in the nation. That's lifting a lot of those workers also out of poverty and improving their lives, but it's not enough. And so at the Labor Center, we do, periodically we do studies called the public cost of jobs in X industry, so like probably cost of jobs in construction. And what we find is that in some of the lowest paid industries in California, workers have to rely on these public programs like SNAP, like Medicaid, like the Earned Income Tax Credit in order to make ends meet because they don't get paid enough to be self-sufficient. So the minimum wage is one tool to help workers as some of these rely less on these programs, but it's not enough. In terms of what the governor himself can do, we've even before the bill, there were some cuts to Medicaid at the state level. So there was already some issues with what the governor was doing in terms of disenrolling workers and families on Medicaid now. So I'm not going to touch that piece, but just I'll say that.
Great, thank you. We have a question regarding work requirements for Medicaid. How will people receiving Medicaid who work at jobs or as independent contractors with variable, non-guaranteed hours be impacted by this work requirement?
I wish I could answer that question. We don't.
Speak up.
Oh, we don't know yet. There's farmers out here, there's agriculture, there's people who don't clock in, there's people who don't have a set schedule. So we haven't received any instructions or directions of how we're supposed to do that, right? And I say that we because at the health centers, all those community health centers that you saw up there, we have what's called certified enrollment counselors. And these are the individuals that help families sign up for Medi-Cal or Medicaid. And we have received no instruction yet in terms of how we're supposed to approve this or pass this on to families. So we don't know yet.
No guidance has been given.
Correct.
Yeah. All right, well, stay tuned because it probably will be ugly.
Right.
If I can just add one more thing, and not just to this question, but also to the previous one, is that a lot of the major cuts in the bill will not be implemented until after the midterm elections, and that's very strategically. One of the reasons why I don't have guidance yet on a lot of these things is because they're delaying some of these cuts until after those elections.
Right, very good point. All right, this is from Rand. What about professional staff, example, physicians, nurses at public hospitals? Will they stay in the area to continue their practices? My dentist has considered leaving the country. Apparently Europe and Canada have been offering positions. And then a second question, how will this affect the WIC benefits? And let me just say, we had a Labor Council meeting last night. We're told that Kaiser is laying off nurses right now in San Rafael. So I think it's affecting nurses. They're being laid off from a very successful and profitable nonprofit in California.
The entire healthcare landscape is going to shift. It's going to shift and it's going to move in ways that we haven't seen before in the state of California. And we don't know what that's going to look like. But if Kaiser is letting go of nurses, that is not a good sign for, is it not on? Who turned this on? The light was on. Yeah? Yeah? Okay? Okay. It's not a good sign that if Kaiser's already letting go of staff, especially nurses, that is a pretty dark sign for the rest of us. Kaiser is kind of the gold standard in terms of care and money. So if they're letting go, folks, they're seeing things that we haven't seen yet. So, yeah.
And WIC, do we know how this is, if it will affect WIC?
I don't know. I couldn't tell you about WIC.
Okay.
Yeah, I'm not very familiar with the WIC program. Yeah.
Okay. Next question. Here we go. I think this is for Enrique again. Are the cuts to Medicaid 68% public hospitals, 61% nursing, I think? Or anyway, similar to what other states will see? Asking to see if there's any hope that red states might push back a little bit and step up and help. So is it similar across the board? I mean, the cuts we're seeing in California, will they have the same cuts in Louisiana and Texas and Florida and more red states?
I'm going to let my colleague Brenda answer that question.
Hi, everyone. Brenda Munoz, also with the Labor Center. I want to say the Republicans have pretty much held the line around cutting Medicaid. Even the folks in the Central Valley, right, who have been pushed and had large numbers of Californians enrolled in Medicaid actually held the line. And historically, red states have not even matched, right, what the federal government matches in state dollars. So I think already even before these cuts, they really haven't cared. So I think for a lot of those having less to spend on Medicaid, we're actually allowing them to spend on other things like immigration enforcement. And I just want to add something that we didn't discuss today, but also will impact Medicaid and all of these cuts. I don't know if you've all been following what Trump just did yesterday, which is around deregulating even more AI technology. You've seen that? And the impacts that are coming. So I think some of the questions around how the taxes are going to keep moving to the rich is that right now there's basically free reign, right, as we deregulate technology and AI for billionaires to continue making more money, but also impacting healthcare. So we've already seen that a lot of these technologies are coming in to not only replace a lot of the responsibilities that workers have in healthcare and in other industries, But I think that, he's also banning what states can do to regulate AI. And in California, where this year, labor in particular introduced several bills to be able to not only protect the public from surveillance, right, and from other things, but specifically protecting workers for being exploited even more at the workplace, for being surveilled. With his executive orders, it could mean that we cannot make progress for another 10 years at least. And if that happens, the one tool the workers, at least those who are unionized, will continue to have is the power to organize and the power to be able to collectively bargain.
Thank you. I have another question on this from, has ICE yet been to the Home Depot in Sonoma County?
I'm sorry to say I don't know. I wouldn't be surprised, but we have not gotten reports of arrests there. I usually do hear when, through the North Bay Rapid Response Network, when ICE does make an arrest. And so that would lead me to think that they haven't yet.
Okay, a little bit of good news there, right?
Yeah.
Okay, and this third question regarding environmental concerns. California has pretty strong environmental laws, but we did up until recently. Anyway, we do. Water quality, etc. So have you talked about net effects in California?
So we do have comparatively strong environmental laws here in California. However, many of the programs that we have in California actually are getting part of their funding from the federal government. So this means that we will have cutbacks, we will have the laws in place, but to implement many of the programs, for example, taking care of our forests so we don't have forest fires. A lot of the money that is used for that comes from the federal government. So there's going to be a big crisis in terms of fiscal support for many of the laws that we have in order to implement the policies that we already have. So I don't see most of those laws going away. However, many of the programs are going to be really lacking in funding. And I also just wanted to mention, because this was just mentioned about AI. AI is a massive environmental issue. We're looking at some of the sources that I have read have said that AI is going to utilize 5 times, in another 5 to 10 years, it's going to use 5 times the amount of energy currently used by the state of California. So, and that energy is being needed to support these AI farms, these AI server farms, and that's a huge energy drain. And how are we going to, how's that going to be supported with energy? Well, it's going to be energy coming from coal and gas, so it's going to exacerbate pollution. And now they're trying to reawaken nuclear also to support these. So these are things we've tried to control in California, but a lot of these laws in here are basically saying we don't have very much jurisdiction over that anymore. So I see that as another huge problem for the environment in California.
Okay, here's another question from Eve. Many of us don't qualify for Medi-Cal, but are still receiving subsidies under ACA. Cuts to those subsidies are anticipated as well. Have you tabulated impacts of these cuts on the ACA?
Our healthcare team has done a lot of work on ACA when there's been threats to cut back through previous Congress, the most recent Congress for this bill. I don't believe that they've actually updated any ACA estimates with the HR 1, unless Brenda, I don't think that's right. So I don't think there's any updated information, but in our if you go to our website, if you go to the healthcare team, they have analysis of the proposed cuts to ACA before that didn't actually go through, and that can give you an idea of how cuts to ACA could impact.
Okay, here's a similar question regarding partnership health plans. I think that's different, right? Is there any analysis on partnership health plans?
We haven't done any analysis on that.
Okay. But there is some analysis on the website regarding health plans in a bigger context.
Correct.
Okay. All right. Let's go to the next one up here. This is from Lauren. The big ugly bill is just more supply side economics, which since Reagan has proven to lower the rate of increase in national income. It has cost the U.S. trillions of dollars, most of it piled up in national debt, and is now a threat to national and economic security. Why has this bill, the latest installment in supply-side economics, been allowed to pass by Americans given its devastating consequences? Well, elections have consequences. I think that is obvious. So part of what we're trying to do is educate what this bill does, and that elections do have consequences, and that there's a chance to change it in the midterms and maybe get some balance back in this government. But I don't know, do any of you have any, that's just my 2 cents.
Here, here.
Yeah.
Well, the only thing I would add, though, is that the drafters of this bill do know the elections have consequences, which is why they push a lot of those major cuts till after the midterms. There's also some temporary tax provisions that are like reducing taxes on overtime, reducing taxes on tips. And if you look at the U.S. map, the largest share of workers who would benefit from those temporary tax cuts are in the Midwest and South, and so that's also another political move to be able to campaign on and say that they are giving tax cuts to these workers. The truth about those is that they're temporary. They go away in 2028. There are very few people who would benefit from those cuts, and they're very limited. So you can only get cuts on 25,000 of the tips and only 12,500 of the overtime. And so there's very few people will benefit, but they sound good. They're good sound bites. So there is some strategy in the bill.
Yeah.
So about the elections having consequences, I feel that one of our really critical problems here is that we know elections have consequences. Why did people vote for this? And if you look at all of these issues, so many, Medicare, Medi-Cal, food, the environment, and so on, most Americans don't really support what's being done. However, our essential problem is information. And we're trying to deal with the information problem here with this forum. However, when one of the largest news networks in the country is Fox News, people don't read newspapers anymore. We have a real dearth of education about what the consequences of things like this bill are and what's actually going on in our country. So how are we going to fix that? And I think the way we fix that is on the ground. We have to start talking to our neighbors, even here in our nice little progressive green bubble. We need to be talking to our community about these issues and working to educate our fellow residents and citizens in our county, because the problem is most people just don't know exactly what's going on. And our elections are increasingly being just a poll of market share of media. So we need to fix that, and we can do that by talking to people and being boots on the ground.
Yeah, thanks for that. Yeah. So I've been saving a couple of questions regarding actions. What do we do to change the environment that we're in right now? And part of what we're going to be presenting here towards the end of is some actions that you can actually take. And I forget, a young lady came up to me and said, she's thinking about starting a website or a blog or something that says, an action a day keeps the tyrant away or tyrants away. An action day it's good for our mental health, right? If we're really upset with what's happening, What can we do about it? Well, there are a lot of things we can do about it, from very easy things to committing to go to CD3 and precinct walk and everything in between. So we're gonna have a little section here towards the end where we're gonna highlight some of the organizations that are trying to put together programs that are going to make a difference and change this this paradigm we found ourselves in right now. But I've got another question here that is, I won't read the whole thing, but basically I have a family member who has schizophrenia, unable to hold to work basically because of this disability, and too sick to work and stay employed for long. So is there a way that this person can stay on Medi-Cal coverage given this illness that they have?
There will be exceptions. I think that would be one of them. But again, we haven't received any specific data in terms of who gets to stay, who doesn't, or any requirements.
Guidance, but
yeah.
there will be exceptions.
So this has a few questions on it, so I'm going to pick a little bit. Can we just decrease exposing recipients of CalFresh to ICE? You mentioned about picking up food for them, but are there other ways to do that?
Reduce their risk of being confronted by ICE?
Yeah.
Well, no. I mean, when we pride ourselves on being a public-facing, I mean, we're here every Thursday, twice a day, with massive lines and happy people greeting them and sending them away with a bounty of fresh produce. So, I mean, part of the accessibility is being in public places that people can easily find you. That's, in a normal environment, that's great. So we're not hidden and hard to find. We have been doing just internally at the food bank kind of risk assessment. So we have a Get Food page, which you can just go on and find out in any given moment where you could get food this afternoon, where you can get food tomorrow, and what community, and what time, and what's the address, and do we have diapers, and all the things. And we've been doing that risk assessment to say, okay, is this also a roadmap of disruption? And it is. But we're still seeing new people that have never come to us before every day. And so how do you remove the resource of how they find out where to access food, but also it is this, it's a roadmap. We have not, across the Feeding America network of, hundreds of food banks, going to food distributions has not been like the thing. If a food bank has been impacted at all, it's been because we often host food distributions at like subsidized housing sites. And so if they're going to a Section 8 housing development and maybe a food distribution happened that morning, of course the food distribution can be impacted, but they're not there like to disrupt the food distribution. That has not happened. Nor have we been given any indication that that is sort of the strategy. Of course that could all change, but we were just robust at handing out know your rights information, and we're getting training and hanging out with colleagues all the time just to say, how do we keep spreading information? But really, if people are concerned about coming, it's that they could have somebody else pick up for them.
Mm-hmm. And this says SNAP cuts begin in 2027 or the beginning. Do all these cuts happen at the same time? And I heard somebody say 2027. I thought it was 2026 that this would kick in.
It's a little bit of both. So some things are in 2026, some are early 2027. Again, we've acknowledged it's part of the strategy of when the midterm elections are. But I will say, from the Redwood Empire Food Bank perspective, even when COVID sort of disaster benefits were ending, so people that were on CalFresh, and just the supplemental disaster CalFresh was ending a couple of years ago in March, we saw our participation skyrocket. And that was not about the people that lost those supplemental benefits. It's because people are scared. And if you are a senior that has, time, and you're watching the news and you're hearing things on the radio and you're on a fixed income and all you're hearing are cuts and scary things happening, you hear something is going away, well, you panic. So people don't know the difference between Social Security and CalFresh and their retirement and their, cost of living. I mean, they don't even know the distinction of all these things. And so even though this isn't happening until 26 or 27, people are responding to it and scared and kind of freaking out now. And it's just an indication of they're going to do that for another year and a half and beyond.
Are there other healthcare cost reductions related to clinics, hospitals, and facilities?
What do you mean by other?
I don't know. It's, I guess that those healthcare cuts relate to all of that, right?
Yeah.
More sick people. Hundreds.
Yeah, more, well, what's going to end up happening is that when someone loses healthcare coverage, when someone loses Medi-Cal, they're uninsured, right? And where do those folks usually end up at? Either at community clinics or they end up in the ER. And that is going to create an increase, a dramatic increase in the unfunded care costs that every community clinic and that every major hospital has. And when that goes up, that creates more debt for us. It becomes a strain on our current budgets, and we have to find ways to fundraise for it or to meet those costs, because we can't go bankrupt. This community depends on us. And so that's when we have to end up getting creative, whether we cut employees, we cut services. We have to find a way to make ends meet, to stay in the black, because we have to. But you know, that is the path that we're going down. So, yeah.
These last two questions relate to where we go from here, so I'm just going to read them both to give us some food for thought. We are being kicked in the face. How can we organize to make sure that everybody has what they need? How can the Labor Council take the lead on this? We will talk about that, but we are trying to take some kind of a lead on that. But there's more to come when Marty comes up and talks about what comes next. This last one is, MAGA is a euphemism for make the U.S. white and Christian. So all of the problems presented are intentionally to make Latinos and everyone not white, like the question writer, leave the U.S. What are your comments to the claim, and how will we fight back against this? If anybody wants to say anything, but I was just kind of, those were directly asking questions about where we go from here. So do you want to?
So the only thing I would answer to that is that earlier this month, the U.S. Department of Labor put out a tweet that said that all the job gains since January 2025 in the U.S. have gone to native workers instead of foreign workers, and he said it's a victory for Trump. Which, number one, it's bad math. It cannot possibly be true. But number two, foreign-born workers in the labor data doesn't mean they're not documented people in the U.S. Elon Musk is a foreign-born worker who's a U.S. citizen. Melania Trump is a foreign, right? But so that's quite a change in the narrative of what we're for as native-born workers versus, we want, criminal illegals out of the U.S. So there is a gradual shift, and the Secretary of Agriculture also said that they were going to have 100% native workforce, like that was the goal. So there is it's a moving target.
We're going to go pick grapes, right? I'm sure. So first of all, I want a great hand for our panelists involved in this. So before I invite Marty up to talk about where we go from here, I just want to say that there's a lot to do, and we've been doing a lot of it. As Una said, getting out there, these demonstrations, these rallies, they matter. They do something. It may not feel like it in the moment, but we keep out there, keep the pressure on. That's what ended the Vietnam War back in the 60s. So we need to keep at it, keep moving. Every time there's a call, try to show up if you can. And Marty's going to talk some more about that.
Hi there, I'm Marty Bennett with Unite Here, Local 2. representing hotel workers, and I'm also a delegate to the Labor Council. And we hope this forum, many of you are already involved, we hope this forum will inspire you to become even more involved. And if you look along the walls and in the back, we have representatives of various organizations that you can talk to when we adjourn in just a few minutes and learn more about how you can be involved with the activities that they're engaged in pushing back against Trump too and building a united front against fascism. So let me just talk briefly about each one and their signs, and you'll find representatives at the table. For the Labor Council, this is our second forum, educational forum. There will be more. We have also organized demonstrations in support of federal workers and postal workers. There will be more. And the Labor Council is also active in supporting union contract and organizing campaigns throughout the North Bay. Indivisible Sonoma County has organized numerous national demonstrations and actions this year, and there will be more. Indivisible also organizes the Tesla takedown rallies every Saturday at the Tesla showroom in Santa Rosa at 11 a.m., as well as demonstrations on the Santa Rosa and Petaluma one-on-one pedestrian overpasses, and weekly actions in several other cities. Sonoma County Conservation Action is one of the oldest and most effective environmental organizations in the county. Conservation Action is now gearing up for ballot initiatives in 2026 to renew funding for the STAR Track and likely another for funding for the regional and county parks. They are now recruiting paid and volunteer canvassers for these endeavors. VIDAS Legal has offices in Santa Rosa and Petaluma. VIDAS offers a wide range of legal services to immigrants. Just a few of those include removal defense, asylum, U visas, work authorization, permanent residency, and naturalization services. The North Bay Rapid Response Network. It distributes the red and yellow Know Your Right cards throughout the county, operates a bilingual hotline, provides legal observer training for ICE raids, and organizes accompaniment teams for immigrants seeking asylum or those targeted by ICE. Healthcare for All Working Group is an organization with strong ties throughout the North Bay and the North Coast, fighting for guaranteed universal health care for all in California or single payer, financed through a much more progressive tax structure, as well as the removal of profit-making insurance companies from the entire healthcare system. Redwood Food Bank provides a range of services for families experiencing food insecurity, including distribution to immigrants who are afraid to come to or visit the food bank. They also offer nutrition classes and work on campaigns to address the root causes of hunger. Over 11,000 volunteers work at food banks in Sonoma and 4 other counties. Finally, Veterans for Peace and other veterans groups are organizing a weekly vigil at the Santa Rosa VA from 11 to 1 on Fridays to support the VA staff and protest cutbacks to veteran services. And I believe we have the Sonoma County Democratic Party here tonight, who's organized a broad coalition to push back against the Trump 2 agenda, and they are canvassing in red California districts that they think can be flipped. So go to the table, talk to the representatives, and we hope to be working with you all in the future.
I just want to end by saying that you can go to our website and Sonoma County Indivisible's website. We try to keep that updated with every rally that's happening, what day, where, and so forth. So if you check those two, you pretty much will be kept in the know. And did you have?
Yes, I also want to acknowledge our 2 amazing interns from UC Berkeley summer internship. So Emma and Kiara, thank you for keeping us on time and helping us, and we're very grateful for the 2 of you.
Really quickly, we also wanted to give a big shout out to Eliana for putting this whole thing together and for even getting us to be here interning at this amazing site. So thank you, Eliana, you're the best boss ever.
We've seen her working really hard the past 3 weeks, every single day for this event, so I think we should do a big round of applause. She cares a lot about everyone in this community and the people at her job and everyone, so yes, many rounds of applauses for her.
Another round of applause for our panelists. Thank you so much. Yeah, and eat the food. There's more food back there.